So now let's start with the galactose metabolism. So there is a very important metabolism. Galactose and fructose actually should be studied together ideally, because they are almost similar. Fine. In various ways, at least biochemically. Let's say site is a liver, and where in the liver? Liver cytoplasm, right? Liver cytoplasm. Okay, so liver cytoplasm is the major site. Exclusively, actually, I can say it is metabolized by the liver cells. Fine. Then in the liver, okay, we have the galactose. So what is the source of galactose? Like milk is one of the everyday source of the galactose. Okay, milk and the milk products. Fine. So galactose is converted Galactose is converted with the help of the enzyme that's called as galactokinase. Each kinase uses a ATP, so it is converted to ATP. So phosphotransfer reaction by the kinase, okay, the class 2 enzyme. Okay, so galactose is converted into galactose 1-phosphate. Now guys, even hexokinase can act on it. Fine. But hexokinase has a very, very low affinity, or I can say very, very high Km for galactose sugar. Right? So hexokinase is generally not metabolizing the galactose. See, as the name suggests, hexo. Hexo means 6 carbon sugar. So 6 carbon sugar, galactose is also a 6 carbon sugar, right? So ideally this should metabolize it, but it has a very, very low affinity for it. That is why the hexokinase is not binding with the galactose, because it needs a very high concentration of the galactose to be present in the blood. Let's say if the glucose is present in the blood at a concentration of 60 to 100 mg per dl, but galactose is never present in such a high concentration in blood or the cells. Okay, fine. So that's why hexokinase is unable to bind to the fructose or galactose. Fine, guys. So now the galactose 1-phosphate is formed. Now this galactose 1-phosphate is added with the UTP. Okay, so we take the UTP, that is uridine triphosphate, right? And what we get is known as UDP galactose. Fine. Plus we get what? We get the glucose 1-phosphate. Okay. See guys, basically what happens is we took the UTP and we also take the glucose 1-phosphate. Okay. First take it like this. Let's say. Fine. So galactose 1-phosphate we have to convert it to the UDP galactose. Fine. So for this, what we have to do? We have to just transfer the UTP, right? And for that, the enzyme is galactose 1-phosphate uridyl transferase. Okay, galactose 1-phosphate uridyl transferase. In short, if I write this, just to remember, okay. A very important enzyme, Galactose. Galactose is an enzyme which is deficient in the classical Galactosemia. Okay, in the classical Galactosemia. So galactose 1-phosphate uridyl transferase. Fine. Okay, and we also take UDP glucose here, right? UDP glucose. So actually there is an exchange of this glucose and galactose. Fine. So we get UDP galactose plus we get glucose 1-phosphate. Fine. Where was the other use of UDP glucose? Like this will be a question, suppose. Suppose in Viva I asked you like name 2 pathways, enumerate the pathways where the UDP glucose is utilized. So you can say UDP glucose is the, anyone? I'm waiting for your answer. UDP glucose is the starting point of which pathway? Glycogen, right? It is for the glycogen synthesis. It is also used in the galactose metabolism. Right? So that is your glucose 1-phosphate is form. So it is just exchange, and the name of enzyme is galactose 1-phosphate uridyl transferase, right? We'll talk about this enzyme again. And there is epimerase. So glucose and galactose are epimers at which carbon? Carbon number 4. Glucose and galactose are epimers. So again I get, let's say, UDP glucose. So what we can do with this UDP glucose? Okay, this is an instant source of, let's say, again, I can use it for making of the glycogen. I can use it, let's say, for the, in the formation of glucuronic acid. I can use it for various purposes, right? Okay, so this UDP glucose, we can use later again for glycogen synthesis. Let's say, like, if I ask you a question that why the milk is one of the best source of energy for the newborn baby, because the milk or the breast milk, that is lactose. Lactose is made of glucose plus galactose, and glucose is the ready-made source of the energy for the newborn. And what to do with the galactose? See, galactose can give us something, give the baby something, that is UDP glucose, which can be stored as a glycogen. Okay, or it can be converted to the uronic acid, that we'll talk later. You know already uronic acid, right? That is in the mucopolysaccharide synthesis. Okay, fine guys. So yeah, very good everyone. Abhilasha, Nandini, Shreya. So that is your glycogenesis. Okay, fine guys. So what we get is UDP glucose. Okay, now we have the 3 questions here, right? And the deficiency of the 3 enzymes, galactokinase, this one and this one. So we have the 3 types of galactosemia, right? If I say we are talking about galactosemia, then we have the 3 types of galactosemia, right? Okay, so let's take number 1. Okay, if we talk about the clinical disorders, okay, yeah, clinical importance of this particular pathway, right? So number 1, the very important question for every exam, that is classical galactosemia, right? Classical galactosemia. Now guys, classical galactosemia, okay, this is presenting with some classical features, right? Okay, now first of all, you have already with the fructose metabolism, right? So see, in the classical galactosemia, what happens is that the newborn baby, okay, newborn baby will present with, okay, so we are talking about the galactose metabolism and classical galactosemia first of all, right? So classical galactosemia is a classical, the word classical is used for some classical features, fine, right? See, what happens here is that the galactose, okay, is converted to the galactose 1-phosphate. Fine. So this happens in liver and -1 ATP is used. Fine. And rest the pathway is missing. Fine. So the ATPs of the liver is trapped as the galactose 1-phosphate. Fine. So this will lead to what? ATP depletion. So ATP depletion will occur. Fine. And because of this ATP depletion, what happens? There will be the liver failure. Okay, there will be liver failure. And this liver failure will present with the jaundice, okay, and hepatomegaly. Fine. Hepatomegaly means enlargement of the liver. Megaly, megaly, that is enlargement, right? So jaundice, hepato means liver, megaly means enlargement. Okay. So jaundice and hepatomegaly, and all the features of deranged liver function test. Okay, so in the jaundice, as you will see, there will be increase in the bilirubin, there will be increase in the enzymes, ALT and AST, etc. Fine. So guys, this is one of the feature. Fine. Then second feature. Second feature is there will be severe vomiting, okay, after the feeds, breastfeed or the milk feed, right? Suppose the baby was not given breastfeeding, but obviously the milk was given in a different way, right? Bottle fed infant. So that is, it may be again severe vomiting. Okay, so the baby is unable to assimilate the milk. Fine, but in this case, what will happen? The mother will try again and again to forcibly give the milk to the child. Fine. Okay, so baby will get milk again and again, and this will manifest initially as a severe vomiting. Fine. The baby will have later on jaundice and hepatomegaly. Fine. Then third feature, the baby may present with the cataract, okay, which may be as early as the 5 days of the life. Okay, 5 days of life. I mean, this is as early as, it may be let's say in the second week of the life. Okay, it's not exactly 5 days, it is as early as. Fine. So the cataract. So why there is a cataract in this child, right? Why this cataract in this newborn baby? Because what happens, guys, that galactose will accumulate, okay, ultimately. Fine, galactose will accumulate because once the ATPs are decreased, the galactose will start accumulating because it is not metabolized. So this galactose is a substrate for, okay, this galactose is acted upon by the enzyme that's called as aldose reductase. Okay, Shreya, Nandini, Abhilasha, tell me if your sorbitol pathway is over or not. Let me know that. Okay, so aldose reductase is the name of enzyme. Fine. So this galactose is converted to the galactitol, right? It is converted to galactitol. Now with this galactitol, see what we did is carbon number 1, which was a CHO group in the galactose. So this carbon number 1 is now converted into a alcoholic group. Fine. So this is a function of a reductase enzyme, that is aldose reductase, right? Aldose reductase. Fine. So are you done with this topic? No? Or yes, sorbitol? So guys, this galactitol is actually a osmotic alcohol. Fine. So you know what is an osmotic means, right? So this is osmotic alcohol, and guys, this may, okay, this may enter the lens. Fine. This may enter the lens, and in the lens, this may lead to the osmotic changes and cataract. Okay. So in the lens, it may lead to what? Cataract. Okay. So it may enter the lens, right? And it may take water inside because of osmotic properties, and this may precipitate the lens proteins, okay, because of the water, and this may lead to what? Cataract formation, right? So guys, this cataract is a special cataract that's called as oil drop type of cataract. Okay, oil drop. It looks like the oil drop basically. Fine, it looks like that. Okay. Kind of the oil drop cataract. Understood? So this is a special type of cataract. Actually, you will see that the cataract is looking as the oil drop has been spilled over the glass surface. Okay, so like that. Fine. Achha, my question is again to everyone: are you done with sorbitol pathway? SORBITOL sorbitol pathway. Are you done? Yes or no? Please let me know. Fine. So guys, this is your oil drop cataract is formed. So this is one of the, guys, these three are one of the classical features. Apart from them, there are definitely some more features which you should, remember. So if this child, right, is not taken care of, this baby will develop sepsis. Guys, sepsis is nothing but it's a kind of infection, right? infection with the bacteria, like this is like gram negative. Okay, this is just a bacteria, as you remember, and this is particularly involved there, E. coli. Okay, E. coli. So Escherichia, right? You know what is E. coli. So E. coli sepsis specifically. So why the immunity is low, it's not very well understood till now. Fine. This baby later on will develop mental retardation again if not taken care of. Okay. So mental retardation will develop. Okay. Then this baby, female baby, right? So by rule, this is also one of the important feature. So female child will later on develop the premature ovarian failure. Okay. So the female baby will have the premature ovarian failure. Now these words may be little big for you. Okay. So it's okay, it's fine. But just I'm telling you that female child, the gonads, female gonads will be affected, but not the male gonads, right? You can understand this later on further in your MBBS life. You will read it again later on in your life, in your medicine or in your pediatrics again. Fine. Okay, but again the question is back to the same point, that is the classical galactosemia, the name of enzyme deficient. Okay, name of the enzyme deficient is this one, that is galactose 1-phosphate. So what is the name of deficient enzyme? Galactose 1-phosphate uridyl transferase, right? Uridyl transferase. Understood? So female child develops a premature ovarian failure, but male child is not affected in terms of gonads, right? In terms of the gonads. Understood? So that you should remember. So guys, these are some of the classical features which are present in the child. So this is a newborn child again. So this newborn child, when consumes a milk, right, this baby is unable to assimilate the galactose. So galactose 1-phosphate will start accumulating initially, right? So this galactose 1-phosphate will deplete all the ATPs from the liver and will lead to liver failure, okay, which may manifest as jaundice and hepatomegaly, right? Then later on, because of accumulation of this galactose, the galactose converts into galactitol. So this child soon develops the cataract. Okay, already the baby was showing the signs of milk intolerance, right? So severe vomiting after milk feeds. So I can use a word for that, that is milk intolerance. Okay, so baby is not tolerating the feeds. Fine. So these are some of the important features, right? Mental retardation, E. coli sepsis. Okay, ultimately you will realize that these are all important points. These are all the things that you must remember. Okay, for your first year MBBS, right, what is most important is that you should know the classical galactosemia, especially the name of enzyme, and a little bit of clinical features like cataract is one of them. So why cataract? Because you can explain it easily biochemically, right? That is the name of enzyme. Understood? So guys, how to treat this child? Okay, and what are the investigations? So if you do the investigations, right? So in the investigation, the urine may show the positive Benedict test. May or may not. Guys, have you observed this term? It is galactosemia. It is not galactosuria. I mean, it will be there in the urine also, but it has a tendency to accumulate. Fine. Okay. See, fructose urea we always say the hereditary fructose intolerance, and then we say essential fructose urea. Fine. But we don't say fructosemia. No, we don't use this word commonly. But in galactose we use galactosemia word. So when anything is accumulated, that is galactosemia. Right? And if anything is excreted in the urine, that is urea, like fructose urea or maybe pentose urea or maybe glucose urea, like that. And we don't use the word glucosemia. Like for example, I'm giving this example. Okay, so understood guys? So positive Benedict test. Okay, positive benedict test will be there. And there is a test that you will see in your labs later on, that is positive nucleic acid test. Okay, that is a test that will be taken in the practical section. We will also take it later. Just I'm writing the name. And there is a negative, not in the urine, but blood sugar is normal now, right? So blood sugar, okay, is mostly normal, right? Or I can say rarely low. So it is not, blood sugar is not commonly affected in this case. But guys, do you remember that in hereditary fructose intolerance, of blood sugar levels decline to a very, very low level, very dangerous levels if not taken care of, right? So hereditary fructose intolerance always present with severe hypoglycemia and some other features that you must be knowing. I will compare it if you want. I will also just revise it in a few minutes, right? Okay guys, so this will be the investigation part. So blood sugar will be mostly normal. So guys, देखो why I am saying this. So being a doctor, suppose you say that a positive benedict test means you can think of that urine has reducing substances, and you will think of one thing here, urine may have glucose and this patient may have diabetes mellitus. But then obviously you will check the blood sugar. So blood sugar is not high or it may be low, right? So that means it's not diabetes mellitus. Understood or not? See, if you say urine has positive benedict test, so that may be yes, glucose will be present. But blood sugar is normal, so no, it cannot be diabetes mellitus. Understood? Okay, so you can rule out the diabetes mellitus. Okay, for example, in pregnancy also the lactose may appear in the urine, right? Okay, but that will give the positive benedict test, but the blood sugar will be normal. So it's not something the pregnancy induced diabetes or gestational diabetes. Okay. Fine guys. So that is the investigation part. Management part is simple. Okay, what you have to do is the galactose free, or you can also say lactose free diets are given. Okay, lactose free, especially the lactose is the most common source. Every day in a diet, lactose is one of the very common source of the galactose. Okay, yeah, it may be present in, let's say, meats, it may be present in some other foods, right? Okay, especially the non-vegetarian foods, galactose may be present. Fine. But the major source in everyday's life is lactose, right? So you have to give galactose free diets. Understood? This word is very important. Free diets. Okay? Or you can say soya based diet. Okay? Soya based diet. So soya milk, for example, is one of the very important substitute of the milk for this baby. And there are a lot of other formulas are available, right? Okay, lactose free diets are available. Fine guys, okay. So that's it about the classical galactosemia. Okay, now there are some other types of galactosemia. Fine. So there may be the other type of galactosemia. So what are the other types of galactosemia that you should know? Number one, okay, so that is galactokinase deficiency. Okay, galactokinase deficiency. So guys, galactokinase is a first enzyme. So galactose is not at all utilized and converted to galactose 1-phosphate. So here the galactose will increase. So what happens guys, this galactose may convert into galactitol. I told you the enzyme. So this may lead to the cataract formation, right? Cataract at the late age, not initially. Okay guys, there is no milk intolerance here. Okay, no milk intolerance is seen here. So the growth of the baby is going normal. But suddenly, let's say at the age of 3 months or 6 months, there is appearance of a opacity in the lens, that is cataract. Okay, and it is not the oil drop cataract, it is a simple, this cataract is not classified as oil drop type of cataract. Fine. So normal growth curve. Okay, so you will get the normal growth of the child. So guys, this is a disorder which is rarely identified except if the patient gets the cataract. Otherwise, it may even go missed initial part of the life. Okay. Number 2, apimerase deficiency. Okay. So apimerase deficiency. So guys, apimerase is a very important enzyme, right? Because it is converting glucose to galactose and galactose to glucose. So I told you already that it is converting, suppose UDP galactose to UDP glucose. Fine, so this will not be possible, which is a reversible reaction. So this will not be possible. So by yahan pe, like, what will be the problem? Like apimerase, if it is deficient, then what will be the problem? So this is, first of all, clinical features. If we have to see, it is same as the classical Galactosemia plus. It's actually more severe, right? Okay, there is a question from Kanchan that why does it have no milk intolerance? See, the milk intolerance is first thing, that why the vomiting is not there, that is unexplained, right? But one thing I can tell you, that why vomiting is not there, right? Because the ATP status of the body, especially the liver, is not affected. Fine. Okay. So basically the features are coming from the ATP depletion. So in the galactokinase deficiency, the ATPs are not at all utilized. So the patient has no clinical features as such, except the cataract. Okay. Except the cataract. Like in the galactosemia, classical galactose 1 phosphate is accumulating, and that is causing various clinical features, right? Okay, which are still not everything is explained. I tried to explain the common things, like cataract has been explained, why the jaundice or hepatomegaly is, that is explained. Fine, but not everything is explained. Like why the E. coli sepsis is there, that is not explained. So, ऐसा है कंचन की when you read medicine now, like you are now in the first year MBBS, you will find a lot of things, in your MBBS, which are there, but which, which are not explained, which are just relationships that right now there is no hypothesis or there is no theory behind that. Okay, there is no proven facts behind that, but it is association. Yes, it is happening, and it happens there. Why it happens, people don't know, scientists, doctors don't know, but yes, this is a typical feature of this particular disease, let's say. Okay, and you have to remember that. So why not like even the oil drop cataract here? So it's not known, because the same galactitol is accumulated there also. Let's see here why there are more things which are present here. So same as classical galactosemia plus, there is hypotonia. Now why, that is again not known. Right, just because of deficient apimerase, why there is hypotonia? Fine. So hypotonia. So hypotonia is decreased muscle tone. Weak muscles. If you don't know, please write it. Weak muscles. Hypotonia of the child. Child has a typical, a tone, muscle tone is there. If you hold the child will try to, always. What I can say, extend his body or flex his body, right, as per the posture you give. But this child has hypotonia, plus there is nerve deafness. Okay, nerve deafness. Fine, that is again not known why the, let's say, 8th cranial nerve is affected. Right. So guys, beta SIP, you attention, you got it now. So you will find a lot of things in your MBBS right? Where things will go, just you have to digest them. Yes, it happens. Why it happens, you don't know. Nobody knows. Still unknown, right? Whatever we know, whatever is already there in the literature, that we will definitely explain you, right? Way like this, for example. Okay, guys. Now let's see. In this case, everything is same except these two features are extra, right? Achha, investigation, everything is same, so investigation will be the same. Management is different, right? So well, in the management, you have to give this patient the galactose restricted diet. Okay, please highlight this word, restricted diet. Why not the galactose free, right? So not the galactose free diets. Why you are not giving the galactose free diets here? Okay, so galactose free diets you cannot give. So guys, you will see later. You have already seen that galactose is very important part of various lipids. You are not done, so lipids we will take later. So it's a part of very important parts of, let's say, our brain lipids, for example. Fine. It is part of our blood groups. It is part of our, let's say, you have already done with this point, that is mucopolysaccharides. So it's part of, let's say, chondroitin sulfate. It is part of keratin sulfate. You know, keratin sulfate has no uronic acid because the uronic acid has been replaced by galactose. Okay, uronic acid has been replaced by the galactose. So galactose restricted diet, right? Let's see, galactose is important for growth. Fine, galactose is important for growth, right? But here the apimerase is dead. Okay, so glucose cannot make the galactose. This is not possible, right? Okay, now you will say why there is free diet, but in the classical galactosemia, right? In the classical galactosemia, okay, so the growth will not, right? The galactose free diet will not affect the growth. Why? Again, as glucose converted to galactose, right? Because apimerase is present. Everyone, okay? So guys, this can be a question for you, that why in the Galactose deficiency you are giving totally galactose free diet. So will it not affect the growth of the child? No, because apimerase was intact. Okay, but why in the apimerase deficiency there is galactose free diet cannot be given? You have to give galactose. Restricted means, yes, you are not giving 100%, no, but at least you are giving, let's say, 30% of the diet which is galactose, having galactose. Okay, so guys, that is your restriction. Restriction means decreased, not the full or not the normal diet is given, but lesser amount of galactose are always given. And I will also use this term later when we will read, let's say, phenylketonuria. In the phenylketonuria, there is, phenylalanine restriction is done, because phenylalanine is a essential amino acid which our body cannot synthesize. So you have to give that patient of PKU phenylalanine. Understood, guys, everyone? So that's all. This is all about the classical apimerase deficiency. Everyone clear? Okay. So please remember this, right? Okay. Actually, guys, see, the metabolism of galactose and fructose is similar, right? But in the fructose, right? So I am now trying to revise your fructose metabolism, right? Okay, we will revise the fructose metabolism. First of all, let's take a MCQ related to this topic. Okay, so let's take this MCQ. So look at this question. What is the answer? Please let me know the answer. Okay, so guys, what is the answer? See, simple, no? So in newborn baby refused the breast milk since the second day after the birth. She developed the diarrhea on third day, jaundice, hepatomegaly, cataract on fifth day. Urine test for reducing sugar was positive and the blood glucose was found to be low. So low or normal, right? So most probable diagnosis. So what is the important points to remember here? Cataract. Okay, refuse the breast milk and cataract. Right, that's enough to answer the question. Right, that is C. Okay, so let's say if it is A, B, C, and D, so answer is C. Okay, so that's very good. Okay, everyone, very nice. Shreya Bilasha Mandari Siri, very good. Okay, so that C will be the answer. Okay. Fine, guys. So you will get questions like this.